When I select a hospital, it's because I want to make sure that I've vetted that hospital, that I know, number one, that they have the equipment I need to do surgery successfully. Number two, they have the nursing care that I need to make sure that you're being watched closely and that all of my protocols are being closely followed after surgery to optimize your outcome. And that there's a medical team. Usually I have internal medicine doctors follow alongside my team to make sure that all of the medicine issues are carefully handled and that you're medically optimized so that you can heal. What does that mean? That means I have the specialist in internal medicine managing internal medicine. Can I manage blood pressure? Can I manage lab work? Yeah, I can handle all those things. But why would I do that when there's an expert who can handle those things? So for me, one of the things that I look for in a hospital is who's the internal medicine team that will take care of my patient's medical issues after surgery? Who's going to provide the anesthesia? Number one, probably of all considerations outside of your surgeon, is who's going to do my anesthesia? And that anesthesiologist is literally the person who keeps you alive and brings you back, who puts you to sleep, who makes sure that during surgery you're comfortably sleeping, and then when it's time to awake, that you awake carefully. Those things are very important. The timing of the anesthesia is very important. In surgery, an anesthesiologist who's not adept at handling spine patients, especially complicated spine surgeries, don't realize that there's a certain amount of time where we want the muscles relaxed versus the muscles working. We want to be able to monitor the nerves. If they don't manage the anesthesia just right, we won't be able to monitor the nerves. I like to monitor the nerves when I'm doing surgery around the nerves. Why? Because when we look at a nerve that's compressed, I want to know that that nerve actually improves. We look at two things primarily. We're looking at the speed and the strength of conduction. So during most of my surgeries, when there's a nerve deficit, I have a nerve monitoring technician who's remotely supervised by a neurologist, literally watching the tracings of your nerves as we do surgery. What we look at is we look at the baseline function of your nerve. We want to know speed and strength of conduction. When I work around the spinal cord, we add an extra modality. We look at the spinal cord function, the motor function of your spinal cord. And so when we're looking at those things at baseline, we know if there's a deficit to start with. Is there a deficit in the arms or the legs? Believe it or not, when I'm doing surgery on the low back, it usually only has an impact on the legs. But positioning your arms like this to do surgery, there can be an issue with your elbow. There's a nerve in the elbow that just positioning your arms like this, it can flare up that nerve in the elbow, which causes cubital tunnel. So we even monitor that so that if that nerve's getting irritated, our anesthesiologist can adjust your arm position so you don't wake up with a dead arm. No matter what we do, sometimes that can happen because the nerve is already abnormal before surgery, but we can minimize the irritation of that nerve. More importantly, we're looking at what happens to the nerves when we free the nerves. Did they get stronger? Did they get faster? Did both of those things occur? Because when I do an operation, when there's severe nerve compression and we free the nerve of that pressure, new blood flow comes back to the nerve. As that nerve is awakening, sometimes it creates irritation. It'll feel like your nerve is on fire. It may be tingly, like ants crawling on it. It's very similar to when our leg falls asleep and then wakes back up. When our leg is waking back up, we know that just a little bit more time will allow that blood flow to come back to our leg and our leg will feel normal again. When we do an operation, the exact same thing happens. We want to make sure that that nerve, when it feels weird when you wake up, that we know the nerve is just waking up. If we don't monitor the nerve and we don't see, oh, your nerve got faster, oh, your nerve got stronger, then we might think that that is a problem. But when I've done the study and I know the nerve is better, then I see you after surgery and I know, oh, the little bit of tingling, that's temporary. We know the nerve is waking back up. So it gives me peace of mind. It gives you confirmation that what you're feeling is actually a normal and actually beneficial part of the surgical decompression of the nerve. So those things are very important. When I'm doing surgery, my anesthesiologists are very carefully selected because they literally are the determination of whether or not you make it through surgery safely. So it's important for me to know that the team is on the same page as me, that we are going to deliver the best care possible, that nothing is going to be compromised in that patient's surgery. Our only limitation is the fact that we're human, but it's never the fact that we don't care. We really put our heart, our sweat, our tears, and our blood into doing as much as we can for all of our patients to deliver the best care possible.